Hi, I'm Dr. Nisha Hariharan. I am a breast cancer surgeon. Currently, I'm working at the Indo-American Cancer Hospital in Hyderabad. I would like to thank the WomenLift team for putting together such a fabulous program and inviting me to participate this year. My leadership project is an analysis on the trends of follow-up in breast cancer. Breast cancer affects thousands of women in India. While the treatment of the cancer is crucial, it is equally important to focus on what happens after the treatment ends. Follow-up data is of immense importance in breast cancer and oncology in general. It forms the foundation for various survival metrics, including morbidity and mortality for the women we treat. It also serves as a critical time point for us to catch cancer recurrences early, thereby potentially saving lives. Unfortunately, when a woman is not regular in her review visits to the hospital, she is considered to be lost to follow-up. My project focuses on these women who were lost to follow up and aims to study various factors such as geographic, socioeconomic, technological, and disease related similarities in them. I analyzed the data of women treated for breast cancer in my hospital in the year 2017 and tracked their follow up data over a period of 7 years up to 2024. 823 women with breast cancer registered in my hospital in the year 2017. The x-axis of this graph indicates the year of analysis starting from 2017 onwards all the way up to 2024. The y-axis indicates the percentage of women who had at least one hospital visit in that year. My findings indicate that in the first year after treatment or at treatment completion, we lose information on one-third of the women we treat. In other words, for every 100 women we treat, about 30 of them never return to the hospital after they complete treatment. As we progress over the years, at the 5 year mark in 2022, only one-third of the women, or 36%, continue to maintain regular visits to the hospital. Of these women, less than 20% had regular or annual visits, or at least one visit per year. The intervening COVID pandemic could partially explain this irregularity in follow-up. In the next phase of the study, which is currently ongoing in my hospital, we are proactively reaching out to these women to evaluate their present health status and make an attempt to understand the barriers they face in accessing cancer care or follow-ups. At an institution level, I believe these findings will help my hospital enhance its patient tracking systems and implement targeted interventions. On a broader scale, the insights gained could guide other hospitals in the country to do the same. Once the second phase of the study is completed, I hope to be able to generate tangible data that can serve as a foundation for similar studies in other hospitals in the country to generate metadata on this topic. Although this study was performed in breast cancer women, I believe there's potential for similar study to be conducted in all branches of oncology, and I believe there's potential for this exercise to be undertaken by different hospitals in the country. And a metadata of this nature could potentially help policymakers improve the oncology systems in our country. I would like to thank my mentor, Dr. Gagandeep Khan, for her guidance and perspectives during the program. I'm also immensely grateful to my fellow cohort members and women leaders for their valuable inputs during the program, and to the entire WomenLift team for their support. I look forward to seeing you all in person very soon. Thank you.